Students, I'm going to go through the first case. Couple of different things. We're going to make sure that everybody understands the product, which is APC Finder. I have a male, age 3. My dates admit 9/1 through 9/1. Okay, so let's look at this first scenario. He was born with a bilateral hydrocele, also had a hernia on both sides. Okay, so the condition has become troublesome. They're going to do surgery, and the surgery is a bilateral hernia repair with the hydrocelectomy. So with that, my first code is going to be the P83.5. So we have all this. I'm going to hit continue. We're going home. Primary diagnosis, P83.5, which go ahead, and this is the start of our APCs. See if I can make this a little bigger here, which is our congenital hydrocele. So also let's look at our other diagnosis. We have K40.21. Not a big deal on this one, but I did have some students who put in, this is 2-0. I did have some students who put in 2-1. Okay, so it's not specified as recurrent without obstruction or gangrene. Go ahead and pull up my notes. It is with obstruction, as the wording stated, it was troublesome. Okay, to code the 0.21, it needed to say recurrent. So now we look here at our procedure codes. Okay, so we're looking at 5.9, 500, bilateral repair, the hydrocelectomy. The codes some had was, the code that some of you had was only for the hydrocelectomy. The repair needed to be included. You could not code the 55041. The patient was under 5, so we have to go with the 49520. So let's go ahead and get all of those typed in. I'm going to bring this over now, and I'm going to hit Add Procedure. We're going to just key down and put in our 49500. Okay, so with that, here is my first hernia repair. Okay, so a couple of different things also I'm looking at. What is the CPT surgical code assigned? It didn't ask for modifiers on question 3. That's what we need a question 4 at that point. So with this, what you want to do, what I like to do, I right click it, and I'm going to go ahead and add modifiers. I'm going to go ahead and add a 50 for bilateral. Hit OK. All right. So then we go ahead and look at what is our APC, which is right here, 05341. And then our amount is $3,604.89. Okay, question 2. Okay, so then you just go to next patient, but we have a female, age 37, admit and discharge the same day. Okay, with Mia, one thing to remember, she came in, I should say she was found on the bathroom floor by her husband. She was in full arrest. They did CPR. She was down 20 minutes. So the EMTs came, they took over. They found the patient here, the physical exam upon arrival. She was unconscious. She did not have a pulse. So we go down here to the ER note. She was in full arrest. They gave her the epi. So basically here the patient arrived at 11:10. The code was called at 11:45. Never had a pulse, no electrical activity. So the first thing I am going to code here is going to be the cardiac arrest. Okay. A couple of different things I want you to remember. We can code cardiac arrest since we don't know why that patient passed away. Okay, we don't know what the cause of the cardiac arrest. Now, if this patient was admitted and survived the cardiac arrest, and they found out that they had a myocardial infarction or there was a complete heart block, that would become our principal diagnosis. Okay, but since the patient passed away before they could do any testing, you are going to code cardiac arrest. All right, so that is going to be I46.9. The other thing is the CPT codes. We're going to do critical care and CPR. We're given, so we don't code the ER visit. Patient passed away, so we're able to code the CPT code along with the critical care code. So with that, our two APCs are right here, 05722 and 05041. Okay, true or false, the estimated total reimbursement for this case is less than $500. This is false. It was more. Okay, so here again, APC Finder, female 37. I have my dates 9:15 to 9:15. We have an hospital outpatient number 1. So with this, I need to put in my first code, which is going to be the I46.9 cardiac arrest. Okay, and then I'm going to go ahead and put in my procedures. So we have 99291 critical care, and then we're going to put in the CPR 92950. All right, so here, as you can see, it's well over the $500. That's why that needed to be false. We have our two APC codes for this one. So if anybody has any questions on that one, let me know. Let's go ahead and look at patient number 3, John Robinson. With this one, this patient was admitted with GERD. Okay. At this point, they went ahead and did an upper GI endoscopy. Indications heartburn. So they actually, let's go here and move my over here through the procedure, blood pressure, everything was good. They went all the way down to the duodenum. Biopsy was performed, and it looks like they did it to rule out Barrett's esophagus. So right here, they do have the impression that we have GERD. Okay, so normal exam duodenum. So if I go down here, let's go ahead. We have our first two diagnoses listed. And at that point, it should be K21.9 and K29.60. The second diagnosis should be without bleeding. Once we get everything plugged in for this patient, let's go ahead and remember that we have K21.9, our GERD. We have other gastritis without bleeding. Here is our payment. Keep in mind we have 43239, which is an EGD with a biopsy, single multiple. Couple of things I want to talk about that. We did do a biopsy, that's why we need 43239. 43235 does not include the biopsy. And then some students coded 43202, which that is just a plain EGD. I shouldn't say EGD, just a SCOPy of the esophagus. So they did the EGD, they went down to the duodenum, so we have to code the 53239. All right, so here is our APC, our total cost. We will move on to the next patient. Okay, on case 4, this patient is 5, and they were seen in the ER. A couple of different things are coming in with acute lymphoblastic leukemia. They did have a fever. Over the exam, the skin over the Hickman site was extremely red. It was starting to break down. Okay, so keep that in mind. they had an infected Hickman. So basically, they gave him some antibiotics through an IV site. Medical decision making, we'll get into that here. But let's go ahead and look at the diagnosis. So we first start off with C9100, which is my acute lymphoblastic leukemia, not having achieved remission. So, and it says that up in the scenario. Our next one is infection, an inflammatory reaction due to the cardiac vascular device. We have the Hickman that's infected. And then our Y code is surgical operation with implant of artificial internal device as the cause of the reaction of the patient. All right, so let's go ahead and look here. The ER, a few of you had that incorrect. One thing I want you to keep in mind with 99284, once I go down here, you have to remember we need all three key components. We can down code, but we can never up code. 99284 has all three key components. If the decision making was high complexity, then we could have went up to a 99285. All right, so let me go ahead and pull up the CPT code itself. Okay, so we have 99284. And then we are going to look at the scenario up here real quick. As you can see, we have findings or comprehensive exam. All right. We also comprehensive history. So yes, 99284 has both of those, correct? But our decision making is of moderate level. Pull this back over. So moderate level, okay? I can't upcode. So since this does not say moderate, I have to go down to the moderate level 99284. So even though we have 2 out of 3, I need all 3 key components. That's why we're coding 99284. All right, so the other thing with that, let's go down APC on this one, and the cost, APC 05024, and then our total amount is $412.18. Okay, case 5. With this one here, also the last one, the fever is a symptom of leukemia, so we do not code it. Okay, the last one, just a real quick note. This patient isn't in respiratory failure. She has chronic COPD, severe shortness of breath. The main symptoms of ARDS usually develop within a few hours to a few days after the precipitating injury or infection. Many people who developed ARDS do not survive. The risk of death increases with age and severity of illness. Other people who do survive, some recover completely, while others have lasting damage to the lungs. Okay, so let's go ahead and look at this. She came in for 14 years, both physician or family doctors. She's complaining of shortness of breath, cough. So with this, she's on oxygen, receives an order for outpatient chest x-ray. She wishes outpatient therapy, does not want to go to the hospital. One thing to remember, Dr. Pratt documents a detailed history. And then we have problem-focused exam, medical decision-making, a moderate level of complexity. Okay? Okay, keep in mind, with this one, we have to go back and make sure you look at the last lesson 10 coding assignment. This is where all of our information really is. So we are going to just diagnose this patient with chronic obstructive pulmonary disease, which I do have. And then we also have, look at here, we also have Z99.81. So let me pull that up. So right here, I have the COPD, and then we have the Z99. Dependence on oxygen. Okay. So the other thing is with the E&M code, let's go ahead and look at that. I'm going to pull that down because we didn't need to do APCs here. So we want the E&M codes. And remember with the E&M codes, she has been seen here before. And with the E&M codes, if they do a medically appropriate history and physical, we go directly from the decision making, which here was moderate. So that's why we're going to code the moderate 99214. All right. Anybody has any questions on this assignment, please reach out.